Hello viewers, it is Shahid Ali and I am here with a common burning health issue which is diabetes, affecting millions of people around the world. Before starting the video, it's important to remember that here we only try to manage our health problems just with our daily routines and food, and no advice about medicines is provided here. And when you learn the art of food in nutrition, I believe there are hundreds and thousands of health issues which you can avoid just with your food and health habit. If you feel it's worthy of making these videos, kindly subscribe our channels. Your one click can give us a great support. I concluded my video in few steps. Be sure to stay with us until the last moment. I assure every second of the video will make your time worthy. Now we will be talking about diabetes. What is diabetes? What are the symptoms of diabetes? The risk factors basically in type 2 diabetes, prevention from type 2 diabetes, and treatment for type 2 diabetes. Now diabetes is a chronic mean a long-lasting health condition that affect how your body turns food into energy. Most of the food that you eat is broken down into sugar, also called glucose, and released into your bloodstream. When your blood sugar goes up, it signals your pancreas to release a special kind of hormone known as insulin. Insulin acts like a key to let the blood sugar into your body cells just to use for energy. Now if you have diabetes, your body either don't make enough insulin or can't use the insulin it makes as well as it should. Now if you have diabetes, your body either doesn't make enough insulin or can't use the insulin it makes as well as it should. When there isn't enough insulin or cells stop responding to the insulin, then we can study it in two different types. Around 10% of all people with diabetes have type 1 diabetes. Now what is type 1 diabetes? Type 1 diabetes is caused by autoimmune reaction where the body defense systems attack the cells that produced insulin. As a result, the body produces very little or no insulin. The exact cause of this are not known yet, but are linked to a combination of genetic and environmental conditions. Type 1 diabetes can affect people at any age but usually develop in children or young adults. People with type 1 diabetes needs daily injection of insulin to control their blood glucose level. If people with type 1 diabetes do not have access to insulin, they might die. The risk factor for type 1 diabetes are still being researched. However, having a family member with type 1 diabetes slightly increase the risk of developing the disease. Environmental factors and exposure to some viral infections have also been linked to risk of developing type 1 diabetes. Another type of diabetes is type 2 diabetes. Type 2 diabetes is the most common type of diabetes. According to the WHO, around 90% of all diabetes cases are type 2 diabetes. It is generally characterized by insulin resistance, where the body does not fully respond to insulin produced by your pancreas. Because insulin cannot work properly, blood glucose levels keep rising, releasing more insulin. For some people with type 2 diabetes, this can eventually exhaust the pancreas, resulting in the body producing less and less insulin, causing even higher blood sugar level, also known as hyperglycemia. Type 2 diabetes is most commonly diagnosed in older adults but is increasingly seen in children nowadays. Younger adults, due to rising level of obesity, physical inactivity, and poor diets, are also at a major risk. The cornerstone of type 2 diabetes management is healthy diet, increased physical activities, and maintaining a healthy body weight. Oral medication and insulin are also frequently prescribed to help control blood glucose level. In today's video, we will be talking about type 2 diabetes only, because type 1 diabetes will be discussed in our video about autoimmune disorder because it is linked to autoimmune disorder. Now, what are the symptoms of type 2 diabetes? The symptoms of type 2 diabetes are similar to those of type 1 diabetes. It include high thirst and dry mouth, frequent urination, lack of energy, the person feel very tired, slow healing of wounds. Your wound will not heal very quickly as compared to other people. Infection in the skin, blurred vision sometimes, tingling or numbness in hands or feet. These symptoms can be mild, sometimes absent, and so people with type 2 diabetes may live several years with the condition before being diagnosed with type 2 diabetes. So what are the risk factors for type 2 diabetes? The risk factors associated with type 2 diabetes are family history of diabetes. Diabetes might be genetical. If your family having diabetes, you might be at risk of developing type 2 diabetes. Overweight can link to many problems. Diabetes is just one of them. Unhealthy diet. Diet is a major contributor in diabetes. Always go for a healthy diet which include veggies, fruits, healthy grains, and avoid high sugar consumption. Physical inactivity. Staying in home in bed or sitting for a long duration and not doing any work or physical activity or exercise. Your age. Aging might be a contributor as your organs weakens or may stop working as you age. High blood pressure. It might be a contributor to diabetes. Now, what are the prevention? Can we prevent type 2 diabetes? There are numbers of factors that influence the development of type 2 diabetes. The most influential are lifestyle behaviors commonly associated with urbanization. Research indicates that a majority of cases of type 2 diabetes could be prevented through healthy diet and regularly physical activity. A healthy diet includes reducing the amount of calories. If you are overweight, replacing saturated fat, example cream, cheese, butter, with unsaturated fat like avocado, nuts, olivia, and vegetable oils. Eating dietary fibers, example fruits, veggies, whole grains. Regular physical activity is essential to help keep blood glucose level under control. It is most effective when it includes a combination of both aerobic, jogging, swimming, cycling, exercise, and resistance training, as well as reducing the amount of time spent being inactive. Avoid tobacco use, excessive alcohol, and added sugar. You better replace your white wheat with the whole grains and avoid white rice in large quantity as it is high in glycemic index and may spike your blood glucose level. Sometimes fasting is a good practice for your health as it trains your body for better insulin absorption. Improvement in blood sugar tend to be dependent on fasting. Here I provided a list of food with glycemic index. So if you are a diabetic patient or your family member having diabetes, better to avoid food with high glycemic index. Besides, you can reduce food with high glycemic index so to avoid complication in future, as high glycemic index food are linked with other major health problems. What are the management for type 2 diabetes? The cornerstone of managing type 2 diabetes is healthy lifestyle, which include a healthy diet, regular physical activity, not smoking, and maintaining healthy body weight. Over time, a healthy lifestyle may not be enough to keep blood glucose level under control, and people with type 2 diabetes may need to take oral medication. When oral medication is not sufficient to control blood glucose level, people with type 2 diabetes may require insulin injections. Medication for type 2 diabetes. The most common used oral medication for type 2 diabetes include metformin. It reduces insulin resistance and allows the body to use its own insulin more effectively. It is regarded as the first line treatment for type 2 diabetes in most guidelines around the world. Sulfonylureas stimulate the pancreas to increase insulin production. You might be able to save yourself from developing diabetes, so it's more important to control your diet and adapt to healthy activities than using medicines for lifetime. Thanks for staying with us.